Hi, my name is Erin Connor.
And my name is Erika Seehafer, and our research is on a review of a lesser-known contribution to depression. More specifically, our research question is, among adolescents in the United States, how does early initiation of consensual sexual experiences compared to late initiation influence the occurrence of depression and depressive symptoms as a young adult?
According to the American Foundation for Suicide Prevention, in 2018, 48,344 Americans of all ages, genders, and ethnicities died by suicide. We knew that depression was a big component of suicide, and so we began our research by looking at risk factors for depression. First, sexual experience was a risk factor that kept popping up in our preliminary research that we were originally unaware of. We understood that sexual abuse was a well-known risk factor. However, this is different from consensual sexual initiation, which is what we will be reviewing in this brief.
Through our process, we reviewed 4 different research articles that examine if there is a possible correlation between sexual initiation and depression or depressive symptoms as an adult. We found 3 longitudinal studies and 1 retrospective study that we reviewed. Overall, our first article, Timing of First Sexual Intercourse and Young Adult Health Outcomes by Vasilenko, Kugler, and Rice, is a longitudinal study that ran from 1994 to 2008. The participants in this study were as young as 12 to 18 years old when they began the research, and it was concluded when they were in their late 20s and early 30s. This research was performed in 4 waves of interviews across the time period of the study. There were 8,938 participants in this study. Presence of depression or depressive symptoms was measured with the Center for Epidemiological Studies Depression Scale.
Our second article, Adolescent Age of Sexual Initiation and Subsequent Adult Health Outcomes by Epstein, Furlong, Kosterman, Bailey, King, Vasilenko, Steger, and Hill, is research that continued from a longitudinal study called the Seattle Social Development Project that took place starting in 1985. There were 808 people that participated in 15 different interviews that took place from when they were aged 10 until they were about 39 years old in 2014. Depression was measured using criteria from the DSM-IV in this study.
The research, Early Sexual Initiation and Mental Health, a Fleeting Association or Enduring Change, by Wesch, Krieger, Lefkowitz, and Sienik, is a longitudinal study that began in 2004. Data was collected beginning when participants were in 9th grade through 12th grade. Then, a subgroup was contacted 1 year post-graduation for the final data collection. During each wave of interviews, internalized symptoms were measured using the Achenbach Youth Self-Report Measure, evaluating 7 measures of anxiety and depression. During the final wave, post-graduation, students were asked if they had ever had sex with a male if they were female, or with a female if they were male, and how old they were when they first had sex. Data from that corresponding year and beyond was then studied for trends in internalized symptoms.
Our final study, Young Women's Adolescent Experiences of Oral Sex, Relation of Age of Initiation to Sexual Motivation, Sexual Coercion, and Psychological Functioning, by Fava and Bei-Ching, is a retrospective study that took place in 2005 to 2006. It focused on different types of sex and the correlation of depression in young adulthood by utilizing an online participation system to administer a survey to 418 female undergraduate students that asked questions about oral sex, vaginal sex, and ages that they first occurred. There were also questions about symptoms of anxiety, depression, and interpersonal sensitivity using the SCL-90 symptom checklist.
Overall, through the 4 studies, the results were inconclusive regarding a possible correlation between first sexual encounter and depression or depressive symptoms in young adulthood. While the studies' timing of first sexual intercourse and young adult health outcomes and early sexual initiation and mental health, a fleeting association or enduring change, claimed to find a correlation, their evidence was not sufficient enough to maintain this claim of depressive symptoms throughout adulthood. Meanwhile, adolescent age of sexual initiation and subsequent adult health outcomes found no correlation, and young women's adolescent experiences of oral sex, relation of age of initiation to sexual motivation, sexual coercion, and psychological functioning, found differences between different forms of sex in their research. One interesting consistency that we found between all 4 of our articles was that among male participants, none of the 4 research articles found any support of correlation between first sexual encounter and depression or depressive symptoms as an adult. The 2 articles mentioned above as claiming to find a correlation stated that this correlation was only observed in female participants, but again, did not have enough evidence to maintain this correlation throughout adulthood. None of the research articles claimed to be looking for or claimed to find a causal relationship. All research was aimed strictly at correlation. We do feel, however, that further research is necessary in order to have an extensive enough knowledge on the subject matter.
One of the challenges with conducting further research on this topic is the amount of time needed to ensure thorough data collection due to the nature of the topic. Tracking first sexual initiation and its effects through young adulthood takes many years to collect the data and more time for proper analysis and publication. This can be seen with the fact that some of the data used in these studies dates back to the 80s and 90s, and the research was only published in the past decade. The studies used in our research may not be representative of other confounding variables that may impact adolescents today, such as the effects of social media. If longitudinal research were to be done with this generation on how first sexual initiation correlates to depression or depressive symptoms, we would not be able to see the results for another 15 or more years. It was really disappointing to see a consistency in the research of exclusionary language towards LGBTQ+ individuals. Some ways this was portrayed was defining sex in terms of male and female, thus implicitly excluding male and female relations, while one research article went as far as to remove 32 of the original participants from their sample based on them not explicitly identifying as heterosexual. There is a whole demographic of adolescents and adults who are now missing from the whole picture of this research question. Not to mention the effects on the mental and emotional well-being of these individuals from being told that the sex they practice does not qualify as sex. As nurses, we can use this information to be more aware of our word choices when we are discussing sex with our adolescent and adult populations. We want to make sure that as nurses, all of the patients in our care feel welcome and understood. As nurses, we can become better equipped to answer questions about the risk factors for depression and depressive symptoms using the information in this research. We can also use this information and apply it to sexual education programs and community health setting in the field of nursing regarding mental health and sexual practices. This research also helps us as healthcare professionals to differentiate between the effects of sexual abuse on depression and depressive symptoms in adulthood and the effects of consensual sexual intercourse on depression and depressive symptoms in adulthood.
The disclaimer at the bottom of our poster reads, "This work is not original. This is an evidence-based practice brief that includes published research conducted by professionals. Guidance was provided to us by Stephanie Burkholder, professor of NU 307, Evidence-Based Practice Research Methods. Thank you for visiting our presentation.